In 2006, 49% of pregnancies were unintended. Of that 49%, 43% ended in abortions. According to the Center for Disease Control and the NCBI website, last accessed on October 30th, 2018, the use of long-term birth control can aid in a decrease in the number of unexpected and/or undesired pregnancies. In this conversation, I will explain to you what an IUD is, how long it can protect you for, what it takes for it to be inserted, and of course, the risks and the benefits of having an IUD. So the first question is, what is an IUD? An IUD is an intrauterine device that's used for contraceptive. It is a little T-shaped plastic piece for the hormonal IUDs. This is a Mirena. Mirenas are good for 5 years. So it's placed in the office with a doctor or nurse practitioner or midwife. Takes about 15 minutes for it to be inserted, but let's go back a step. So the types of IUDs. So you have hormonal IUDs and you have non-hormonal IUDs. So hormonal IUDs, when they're inserted into your uterus, they excrete progesterone, which is located in the casing itself. So in this piece right here, it secretes a hormone called progesterone, which tricks the body into thinking that it's pregnant. So then it creates excess mucus in the uterus itself. It creates mucus built up in the cervical opening, which prevents pregnancy because it prevents the sperm from getting to where it's going. The progesterone also stops you from ovulating, which no egg, no baby. Now, the copper IUD, which is called the Paragard, is inserted the same way these are, the regular hormonal IUDs, only there's no hormones in them. The Paragard is a copper IUD, so it looks just like this, except for there's little pieces of copper that are right here and right here at the top. And that sperm does not like copper. So that's inserted into the IUD and inserted into the uterus in the doctor's office, and sperm avoids it at all costs. Now, effectiveness of IUDs. So Skylas are good for 3 years. Mirenas are good for 5. Kylenas are good for 5 years as well. And the Kylena is a little bit smaller than the Mirena is. So they recommend the Kylena and the Skyla for women who have not had any children. So this is the actual Kylena device. It is tinier than the Mirena. So the CDC, the Center for Disease Control website, last access October 30th, 2018, states that 1 in 100 IUDs can lead to pregnancy. So out of 100 people, one person gets pregnant prospectively with an IUD. Now, long-term care versus short-term care of IUDs. So long-term options are things like the IUDs, obviously. Like we discussed, the Skyla, the Mirena, the Paragard, and the Kylena are all good between 3 and 10 years. The Paragard, which is the copper one, non-hormonal, is good for 10. Short-term birth control, such as pills, the NuvaRing, the Depo-Provera shot, cervical caps, and condoms, those all have like a 98% success rate, according to the Center for Disease Control. So IUDs, intrauterine devices, are considered a set it and forget it. So once it's inserted, usually within 24 to 48 hours, it's safe to have unprotected sex. Now, with that in mind, these do not protect against sexually transmitted diseases. Pills, NuvaRings, Depo-Provera, cervical caps, and condoms. Pills, you have to remember to take them every day at the exact same time. NuvaRings, 3 weeks in, 1 week out. It's actually in your vaginal canal. It sits next to your cervix, and there's a lot of times that the partner will feel them. How the IUD is inserted. So you go into the doctor's office, you get it all ordered, it's all taken care of. The provider will come in once it's in, whatchamacallit, you will go into the exam room, waist down, then they use the speculum, which is a metal or plastic device used to open up this vaginal canal. They measure your uterus by taking this, and they see how deep it is to the top of your uterus. So once it goes all the way in and they feel the resistance, they know how deep your uterus is, and then they can insert it. So if your uterus is 6, we put it at 6, and then you take this and you insert it all the way into the top. You pull this back. This then sticks in the top of the uterus, and then they take it out. You have the strings, which usually your partner doesn't feel, or they shouldn't feel. Once they remove this plastic device, this is an educational device, so I can't technically remove it. They pull this piece off, and then they take the strings, they cut them to just outside of your cervical opening, and then set it and forget it, you're done. You take some ibuprofen before the appointment, and you're good to go. So, long-term risks and benefits of the IUDs. So long-term benefits obviously is protecting against unprotected pregnancy. Decreasing your menses. So if you have a very heavy period, the Mirena is supposed to be really, really good for that. It decreases the frequency and decreases the flow. Possibility of pregnancy after removal of the IUD is very quick. So if you have it removed on a Monday, you could be pregnant within 3 months. Risk, it does not protect against STDs. With the IUD, if you have extra partners, not excessive, but extra, so if you're sleeping with one person instead of 2, your risk will be lower. So pelvic inflammatory disease, bacterial vaginosis, yeast infections can all be caused by the insertion of the intrauterine device. So in conclusion, while there are so many forms of birth control, ultimately my favorite long-term birth control, and I find that the one that works the best, is the intrauterine device. It's highly effective. Like I said, 1 in 100 people, women with an IUD, will get pregnant. Insertion and removal are very simple. They both take about 10 minutes in the office, except for the wait time for the provider, of course. And the long-term benefits, if you have really heavy periods, you don't want children, or you don't want children right now, the benefits definitely are amazing. The risks are minimal compared to long-term birth control options. These can be inserted at your 6-week postpartum visit, so 6 weeks after you've had your baby, you can insert them. Planned Parenthood gives a lot of really good information about Mirenas and Paraguards. Paraguards, with being hormone-free, are very beneficial to those people who can't take medication that could possibly cause blood clots. So there you have it. why you should use an IUD to prevent your pregnancy. Right there, 15-minute insertion time. Thank you. Have a good day.